I'm Choi. I'm a nursing student from George Brown. I'm in a third semester. My ID is 1014599626. Today I'm gonna demonstrate the constitution and preparation of IV pantoprazole for my patient, Mr. Singh. He's 76 years old and has a GI bleeding issue. So doctor ordered 30 milligrams of the pantoprazole IV in 50 milliliter over 20 minutes. This demonstration will show up to the completion of second medication check. So first I'm gonna check the prescriber's order and the MAR. So first, the prescriber's order, I see the patient name, Sydney, and date of birth 1950. And on the MAR, patient's name, Sydney, and date of birth 1950, September 2nd. And the prescriber's order, it says not known allergy, and the MAR, not known allergy. The order on the prescriber's order is pantoprazole 30 milligram in 50 ml, normal saline, route is intravenously over 20 minutes. On the MAR, it says pantoprazole 30 milligram in 50 milliliter, normal saline, and route is intravenously, and the time over 20 minutes. So I'm gonna draw the medication from the patient's drawer, and I found this medication, pantoprazole 40 milligram powder, 1 vial, and then sodium chloride 10 milligram. Pantoprazole for my patient Sin, it's for GI bleed. It reduces the production of the acid in the stomach, and it supports the clot stability as well as reduce the further mucosal damage, and it may cause headache, insomnia, fatigue, diarrhea, abdominal pain, and rash. So these are my supplies. I draw the medication from my patient drawer, and it is pantoprazole 40 milligram and powder form in a vial. Expiry date is 2026 September 28, and everything is intact, so I can use this. And this bottle here, 0.9 saline, sodium chloride, 10 milliliter. Expiry date is 2030 March, and intact, I can use it. And also there's this 0.9 sodium chloride 50 milliliter mini bag, and expiry date is 2026 September, and also it's intact, nothing's leaking and no residue. I'm going to proceed the first part of the second check of medication. So on the MAR it says pantoprazole 30 milligram in 50 milliliters of normal saline, pantoprazole 40 milligram and 10 milliliters of the normal saline, and 50 milliliters of the normal saline. Nothing has the residue, so I can use it. To find reconstitution amount for 30 milligrams of the pantoprazole, I'll use this formula. So the vial has 40 milligrams of the pantoprazole. It has to use with 10 milligrams of normal saline, and its ratio has to be equal to 30 milligrams of the pantoprazole and the X milliliters of the normal saline. 10 milliliter multiply 3 milligram divide by this two number, 40 milligram multiply X milliliter of the normal saline. I'll cancel all the units, and it comes to 300 divided by 40x, so it'll be 30 divided by 4x, it'll be 7.5. So X number is 7.5 milliliter of the reconstitution. Before preparing the medication, I'm gonna perform hand hygiene for 15 seconds. So apply the medication. top of the hand too, and then thumbs and wrist too, and then nails too. And then dry for 15 seconds. So dry for 15 seconds. First, I'm gonna open syringe, blunt needle, and also I'm gonna open the bottle of the saline and the pantoprazole. And first, I'm gonna assemble this syringe into the blunt needle and put it aside. And then I use 2 different alcohol swab to clean the sodium chloride and the pantoprazole. And I use the aseptic technique, clean the bottle for 15 seconds. And also dry them 15 seconds. Use another alcohol swab. Clean them 15 seconds. And then dry them for 15 seconds. Dry for 15 seconds. And I'll clean this normal saline 50 milliliters port area and use the aseptic technique as well. And dry them for 15 seconds. Now I'm gonna assemble 2 of these. To draw 10 milliliters of the normal saline and aspirate in the saline vial. And I'm gonna draw them. Okay. So it is exactly 10 milliliter. And I'll mix with this pantoprazole powder. And draw 7.5 milliliter. And it is exactly 7.5 milliliter. Mix with some normal saline. Don't touch the ports, and then inject this 7.5 milliliters of the pantoprazole. Then I cover the cap and put it in the sharp container. And then I gently swirl. And now I'm gonna write the label here. Patient name, Sin Lee, and drug is pantoprazole, and time of run for 20 minutes. Label. And then attaching to back of the piggyback. Before take it to the patient room, I'm gonna double check. So with the MAR and pantoprazole, and patient name Sin Lee, date of birth 1950, September 2nd, 1950 September 2nd, and pantoprazole 30 milligram in 50 milliliter, normal saline, and route is intravenously, and the time over 20 minutes. In order to find the drip rate, I have to use this formula and these three numbers. So I'm going to apply three of this number into this formula. So first, I'm going to multiply 50 milliliter of the saline bag, multiply drip rate 10, and divide by 20 minutes. And I'm going to cancel all the units, and the numerator is 500 divided by 20, and it comes to 25. So 25 is the drip rate per minute with gravity. This is flow rate calculation to set up IV pump, and we have these numbers: total volume 50 milliliter and time 20 minutes. But we have to set up IV pump with 60 minutes, so I'm gonna use this formula and apply these numbers into this formula. It's gonna be 50 milliliter divided by 20 minutes will be equal to X milliliter and divide by 60 minutes. I'm gonna just cancel all the unit to simplify this calculation. So I'll calculate this way, and 50 multiply 60 divided by 20 x. So the upper number will be 3000 divided by 20x, and it's gonna be 150. So x number is 150, and this is gonna be the flow rate volume, and it's gonna run for 1 hour. So we have to set IV pump 150 milliliter per hour. Before administration, I'll check the Mr. Sin's baseline and vital sign and baselines of the gastrointestinal status, such as if there's any GI bleed or bloody stool or weakness. Also, I'm gonna check the IV site before administration. So if there's any swelling or redness or irritation, if there's any infiltration. And after administration, I'll document the medication, dose, route, and time given, and also I'll document the condition of IV site and patient's response to the medication. I'll also educate my patient after the administration if there's any side effect appears, such as nausea, diarrhea, headache, and he should report it. After administering the medication, I'll also check any signs of bleeding, and also I'll check side effects or adverse effects related to the medication. If there's any, I'll document it. To summarize, I have prepared for pantoprazole 30 milligrams in 50 milliliters of normal saline. It's gonna run for over 20 minutes, and I calculated the drip rate. It is 25 drops per minute, and for the pump, I calculated for 150 milliliter per hour, and I have completed my second check of the medication, and now it is ready to administer.